Hi everyone, my name is Janice Baez, and today I'll be presenting on Article 25, the right to an adequate standard of living. So, to start off, what is Article 25? Article 25 of the Universal Declaration of Human Rights states that everyone has the right to adequate food, housing, clothing, medical care, economic security during unemployment, illness, disability, or old age. This article really stood out to me because it says everyone has the right to basic necessities when it comes to healthcare, housing, and food. However, not everyone has equal access to these resources. So that's why I thought this article would be interesting to focus on, especially when it comes to social workers advocating for them. So, slide number 3, how is Article 25 being violated? So, one of the reasons is rising healthcare costs in the United States. Secondly, Medicaid funding reductions. Third, delayed medical care. And then fourth, increased financial hardship for families. So, Budget Reconciliation Bill HR 1 is projected to reduce federal Medicaid spending by approximately $1 trillion over the next 10 years. Even individuals with employer-sponsored insurance continue to hold off seeking healthcare due to growing expenses. So one of the reasons I chose this topic is because we've been seeing a lot of conversations recently about healthcare costs and Medicaid funding. Even though healthcare is recognized as a human right in Article 25, many families still struggle to afford medical care. I also thought this was relevant, considering recent legislation, kind of like debates about Medicaid and the decisions being made by our presidential administration. So it's kind of like a hot topic right now. And then slide number 4, systemic barriers that create the injustice. So one is Medicaid funding cuts. Secondly are barriers to transportation. Third, growing medical expenses. Fourth, lack of medical professionals. Another reasoning is poverty, and then geographic disparity. And then my fifth slide, strategy. The strategy that I thought of to combat this systemic barrier would be to expand school-based health centers through mobile health clinics. So schools could partner with hospitals and community organizations to provide primary medical care, counseling for mental health, preventative screenings, vaccinations, and family resource navigation. So because children already spend most of their day at school, it just makes sense to bring healthcare to them instead of expecting families to overcome transportation or financial burdens or barriers. So these partnerships could provide things like physical health care, mental health counseling, like I previously said, and just help connecting families to community resources. And then supporting evidence. So, school-based health centers increase preventative health care, increase immunizations, reduce hospitalizations. And then as for mobile health clinics, more than 3,600 mobile clinics operate across the United States. They provide over 10 million patient visits annually, and they generate approximately 1.7 billion in healthcare value. So a lot of benefits to them, um, being a solution. And then just a role as a social worker. So, my role and for other social workers in regards to this article would be to promote healthcare equity, encourage Medicaid enrollment, provide resources to families, partner with schools and healthcare providers, advocate politically to influence laws and regulations, and then lastly, at the end of the day, my hope is to shape a sustainable future for all. So healthcare is accessible to all children, regardless of their financial situation. I would want schools to serve as centers for community wellness, and then prevention, equality, and dignity are given high priority in policy making. And then as I move forward, part B will be professional advocacy. So for this part, I chose to discuss impact for equity. So this is an Illinois-based public interest law and policy group. They promote racial, economic, and social justice. They use legal advocacy, policy reform, litigation, and community partnerships. So, impact for equity in action. Something that really stood out to me while researching this organization was kind of the variety of the ways they advocate for change. One of them being their annual event, which is called Raise the Good Together, where they bring together community leaders, advocates, and policymakers to work toward a more just society. I was also impressed by their work with the Illinois Department of Juvenile Justice, where they helped create a plan focus on education and rehabilitation instead of punishment for youth involved in the justice system. In 2023, they even changed their name to Impact for Equity to better reflect their commitment to fighting injustice. And then my plan to become more involved, I would want to stay informed about state and federal legislation, support legislation promoting healthcare, housing, and educational equity, participate in advocacy events and educational opportunities, apply these principles to my work as a school social worker as well. So, overall, this organization is a reminder that although helping individual clients is important, I do believe advocating for improved practices and policies is just as important to bring about long-term changes. So that is all. Thank you for listening. And then here are my references.